Okay, guys, ready? Okay, view, slideshow. Okay. Can't see your screen yet. Is that what you're doing? Yeah. Can you see it now? Yeah. Okay. Good afternoon, everyone. This is Adrienne McConnell, Product Development Coordinator with Lovelace Health Plan. I'd like to thank you for joining our webinar today. And just a little housekeeping before we begin. Could everyone please take a moment to mute their phone by pressing *6. Okay, thank you. For today's webinar, we'll be hearing from Mike Nunez, Executive Director of New Mexico Health Insurance Alliance. Mike will be providing us with an overview of the Alliance and also general updates. Following Mike's presentation, Heather Rising, Product Manager at Lovelace Health Plan, will be going over the Alliance plans that the Lovelace Health Plan offers. We will then open up the phone lines for questions for Mike and Heather, so please hold your questions until the end. And now I will turn the webinar over to Mike.
Well, good afternoon, brokers. My name is Mike Nunez, and I am the Director of the Alliance. And if I haven't met you yet, I welcome the opportunity to meet you in the near future. We've made an outreach to brokers over the last 2 years in that we do a certification class so that you'll know what needs to be done to interact with the Alliance. And by my count, we've reached out to about 250 brokers over the last 2 years. So we hope we know most of you, but for those of you that we don't, I'll try to give a little bit of overview and some of the things that are going on with the Alliance. So who's the Alliance? Well, we're this unique entity that was created in 1994. We are a state-created quasi-government entity, and we're here to provide as a safety net for small businesses and certain individuals who can't qualify for coverage in the commercial market. So for those employers that have employees with populations of 2 to 50 employees and certain qualified individuals, we can take them. We only require that 50% of eligible employees enroll. We do offer a wide variety of carriers and options, and our rates never increase because of a certain medical condition. Our rates are set by statute. We follow a process where all the index rates of the different carriers are combined into an alliance rate, and that alliance rate is what we publish. We're going to talk about some discounts and things in the near future here a little bit later in this presentation. And another unique feature of the Alliance is that employer contributions are optional. They're not required. Now, few employers fall into that category, but if you have that unique employer that wishes to pass all the cost on to the employees, we can accommodate that. Move on to the next slide. You'll see that we have a lot of business relationships. These have grown over time, and hopefully they've been intensified over the last few years. But we do work with about 18 Chamber of Commerce. And just to let you know, we're going through a special effort now to have special outreach to each of those Chamber of Commerce so that they can put up all of our rack cards, which are just cards of information that we are putting out into the community. We've done a lot of efforts to identify and standardize our messaging across all of our lines, radio, TV, distribution points, print, and social media. So we have 18 Chamber of Commerce, and we are working with a number of community support organizations that also get our work out to the people that are hard to reach. We rely on you to do the same. Of course, with the insurance brokers, you are our main channel of production, just like you are to Lovelace here. We rely on you. We're part of all of the broker associations that you can see. The Independent Association, Independent Insurance Agents of New Mexico, the Rio Grande, the New Mexico Group Underwriters, the Northern New Mexico Group. We've met with many of them. We meet with them quite frequently, and we're usually asked to make presentations at them. So we hope we see you there. We work real close with the Department of Insurance, the New Mexico Medical Insurance Pool, and State Coverage Initiative. So we have good business relationships that I think will help you as we move forward. On the next slide, you'll see that we are a third-party administrator. This is no surprise to anyone. We take applications and enrollments and changes in monthly premiums, and we do all the renewals on your behalf. And what we do is we turn that into eligibility for our carriers so they can have the information necessary in which to pay your claims. Once we do that, we make our payments we make payments to the carriers on a monthly basis to fund for those claims. And then once a year, following the close of each year, we do annual assessments that make up for any underwriting losses that we incur. Typically, we take in $1, and beyond that, we pay about $1.30 in claims. So we have to make up that 30 cents, and we make up that 30 cents by assessing all of the businesses, insurance carriers that are doing business in New Mexico, and they pay their proportional share of the premiums that they collect against the total market value. So that's how we collect it back. But we are basically a third-party administrator. Many of you know us that way. We do awareness, we qualify people, we make renewals, we do premium collection, we do eligibility, and we do financial reporting. And that's pretty important. We'll talk a little bit later about how that's becoming a new line of business for us. On the next slide, you know, we try to do a lot of general awareness. Historically, we've done a lot of print ads, radio ads, and we did a lot of billboards. And I take a different approach to that. I'm kind of like I think you brokers are in mentality. I like face-to-face, so I'm more in for broker meetings. We have had some difficulty in getting our broker council going, but it's something that I hope to revive. We tried at the front end of my tenure with the Alliance, but we will bring that up again. Again, you can see we've reached out to chambers of commerce, trade associations, small business development centers, and we've done a great deal of work with website. So if we could flip to the next slide. We redesigned our website, and we hope we made it easier. We hope we made it simple enough for everyone to follow, simple enough for users to find what they need, simple as 1, 2, 3. We did this for a variety of reasons. One is we thought our website was maybe not updated to where it needed to be, and the organization of our information wasn't up to par. So we designed this in anticipation and in the hopes of becoming an exchange, because this is what some exchange sites look like. This one was patterned after some of the Midwestern states. So we put it into play. We tried to make it so that more people would be directed to the website. So from that point forward, after we had a website up, we actually in about July last year, we started a simple campaign. Check out our website and find a broker. Again, it's a simple message, but if people come here, that's what we want to do, is get information to you, referrals to you, so that you can do the things that you do to make them qualified for our business and bring them to us. We tried to put in simple questions within the individual and employer groups so they can qualify themselves. We've seen about a 20% increase in our web hits. We're seeing people staying online about twice as long and viewing about 3 times as many pages. One of the good things about our website is that we've seen a lower bounce rate. That is, people are not just coming into our website and bouncing right out. They're coming in and staying. So we've seen a pretty marked increase of our website bounce rate. It was about 60, 70%. Now it's about 30%. So we're thinking we're making some good gains there. We added videos. You can see it in all possible ways. You have print if you want to read it. You have visual if you want to see it. And you have video if you want to both see and hear it. So we think we have made some gains. The website's there. It hasn't changed too much from before. The broker's connection point on the home page is at the bottom of the page, not shown here, but on the lower left-hand side. So if you turn the page again, this is what we really put our investment in, is getting them to this page so we can find out where they are, and if they need to contact somebody to get us back to the Alliance, they merely need to click a county here. And if you're certified with us, your names will pop up. And if you're part of our, if you've been recognized by our broker incentive program, that is, if you've had net growth increases from year to year, we will identify you as award-winning, and that usually helps drive some of our business to some of those award-winning brokers. We think it's a simple website. If you're not on here, I suggest that you contact us so that you can become certified with us and become a part of this community. We've tried to reach out in other manners as well. If you look to this next slide, this really is the advertisement that we've been doing. Almost everything ties to it. We're here to help, just as you're here to help your clients. But this one is a little bit unique in that we had some brokers contact us, and they asked us, hey, look, we're trying to market to the Alliance. We get it. The Alliance is there and can help us in certain situations, but sometimes we want to market out to some of the folks that might be needing us, and we need an email brochure. So we went back to our website, and we developed this email brochure for you. If you look to the bottom of the page, you'll see that there's a section there where the agents can personalize your data. Now, what you can do if you come into our website is you can set yourself up to look like you want to look. Not completely customized, but if you want to put a picture up, we can accommodate it. You want to put your company name and your logo and your telephone number and email address, it's all there for you to do. And if you do so, we can translate that into this portion of this brochure on your behalf to personalize it for you. So this is our way of trying to get something out to you that you can use to push along. A little bit of statistics here on the next slide, just to tell you where we are at the end of February. We have these carriers. You can see some of them, like the Principal, is now gone. But right now we have about 3,900 members, and we have about 2,500 primary insureds and about 1,500 dependents. And that's a good number. And the reason being, if you look to the right-hand schedule, you can see our history. And you can, if you look back up into about year 2000, you can see we were at our peak then, about 8,800 members. And we've been up and down and up and down and up and down. But if you start to look about the 2008 range, you see the impact of the recession. Maybe you've seen it in your business. We certainly see it in ours. I know you have. We certainly had decline. You see 2008 minus 12%, 2009 minus 18%, 2010 minus 7%. It didn't seem like there was an end to it, but it seemed like at the end of 2011 we were starting to level off. And in the beginning of 2012, we're starting to see some increase. This is just based on year-end numbers. If you look to the next page, these are sort of our results on a rolling 12-month basis. Again, you can see the carriers on the left. You can see Lovelace there. You can see the totals. You can see that we introduced the hybrid last year, so we did have good participation in it, and Heather will talk about that hybrid a little bit later. But then you can see where we've gone from a year ago to now, and we're at a 5% trend increase. We think that there's good reason for this. We have done a lot of work on our pricing. I was curious as to what that was, and we dug deep, and we found out that our PPOs were overpriced, and our HMOs were underpriced. So we have been making adjustments to those, and if you've seen our rate increases, our HMOs and those types of trends have been in the 10%, more recently in the 3%, but our PPOs in the last couple of rate cycles were reduced by about 15% a year ago and another 5% this year. And what adds to that is that the carriers there's more of a partnership with the carriers. Definitely feel it with all of them, but especially with Lovelace. They've come through with new plans and new plan designs, but in addition to that, they've really come through with a unilateral discounted rate of 5% on top of those reductions that I spoke to. And I'm hearing it from brokers, especially in the sort of the hinterlands out there, not so much the urban areas, but more the hinterlands around the state, that our prices are looking more and more competitive. And I think that is a good thing. That's what it should be. The Alliance was designed a long time ago by an actuary at the Department of Insurance who thought that if we priced correctly, we would grow to be of sufficient size such that we would be able to absorb our losses and truly be self-sustaining like an exchange. We'll talk a little bit more about that later, but there's the numbers of enrollment for you. So on the next page, it's basically who qualifies for the Alliance. And here it's pretty simple. Again, if you look to our website, we really ask 4 questions there. And we basically say, are you presently covered? If you answer no, you continue. If you answer yes, you're referred back out to say, oh, maybe you need to contact a broker to find out what you should do. Maybe you need to look to the New Mexico Medical Insurance Pool. So if you go past the first question, the next question we ask you, has there been a break in service of less than 95 days? Well, this is new to the Alliance. It took us a long time to get this. The pool has been a 95-day break-in service for a very long time, since 2008, and we finally have it now in place too. So at least we have a little bit more time to bring people into the Alliance. Then the next question is, were you previously covered under a group plan? And if you are, then fine. Now you move on to the next question. And the next question really is, have you exhausted COBRA? And if you meet that criteria, you come to the Alliance. Now, that doesn't say that we don't pick up other individuals. You might all remember the Eclipse situation. Eclipse was here, a big employer, and they left. And unfortunately, their employees were left without. The Alliance was there to pick them up. You might remember another situation where the symphony, the New Mexico Symphony, was moving along and they ran out of money. Well, guess what? Their people ran out of coverage. The Alliance was there to pick them up. And you might have other small businesses that are not subject to COBRA. And those small businesses might go under. And if they do, and they have no place to go, the Alliance is there to help again. So that's what the individuals do. So the next slide is about small groups. And in small groups, you know, we cover 2 to 50. We can cover 2 employees, of which one has Medicare and at least working 20 hours per week. And we can cover situations where there's 2 employees with 1 waiving coverage, and this is really important, a self-employed person and at least 1 dependent. I can't tell you how many times I've run across that when I just ask the question, do you have insurance coverage? Do you own anyone that doesn't? And I say, do you own anyone that's self-employed and has a spouse? And they all seem to say, yeah. So I try to accommodate that. I know you all do, but it's just seeming to come up in my business all the time. So we ask the questions, you know, are you authorized to do business in New Mexico on our website? You answer yes, you can move on. Do 50% of your employees reside in New Mexico? You answer yes, you move on. Or at least 2 and less than 50 eligible employees working 20 hours a week? You say yes, you move on. You say if there's 2 employees with 1 waiving off? Yes, you move on. Are they self-employed with 1 dependent or spouse? Yes, you move on. So our eligibility, I don't think is too difficult. I hope most brokers know it, but if you have any questions, you can contact Kate or Lori or Sandra, our receptionist, who can help you with all of that information. So as we move forward, and it says how to get started with NMHA, it's pretty simple. We just need to know that you're interested, and if you are, all you need to do is go onto our website. If you're not already certified, there is a box there to become certified, and you need just click it, give us your information, and Lori Graves, our trainer and certifier, goes around the state, and she does an excellent job of giving you all the information you need in order to do business with us. She goes over all of the forms that are necessary. She goes over all the processes, and most importantly, she goes over all of the cutoff dates in which we can make business happen for you, provide coverage to the carriers, and move on. So that's what we do. Am I at a point that I turn it over to you?
Sure.
Well, thank you very much. I'd be happy to answer any questions that you might have.
Thank you, Mike. At this point, we'll go ahead and jump right into the plan designs that Lovelace offers with the Alliance. As many of you know, Lovelace Health Plan has been a proud New Mexico Health Insurance Alliance partner for many years. We currently offer the HMO plan and are excited to announce that effective March 1st, we have expanded our product suite with the Alliance. Now, in addition to the HMO plan that we have always offered, we will now offer the HMO hybrid, all 3 PPO plans, and the 2 high deductible plans, all with prescription coverage through the New Mexico Health Insurance Alliance. This grid gives you a high-level overview of the HMO plans. The middle column is the HMO plan that currently exists with the Lovelace Health Plan, and the right-hand column gives you an overview of the HMO hybrid plan. As you can see, the HMO plan is a pretty standard HMO plan with flat copayment benefits. The hybrid is a unique plan in that you do still have flat copayment benefits for your PCP and specialist office visits, as well as your behavioral health and substance abuse office visits. But you also have a mix of coinsurance after deductible benefits for your facility services. In addition, near the top of the page, you'll see where the HMO plan does not have a deductible. The HMO hybrid does have a $1,000 individual and a $3,000 family deductible. Both of these plans do come with the 4-tier prescription benefit as well. The next slide gives an overview of the 3 PPO plans that Lovelace offers through the New Mexico Health Insurance Alliance. All of these plans are similar in that the in-network coinsurance is 50% and the out-of-network coinsurance is 70% after deductible. You'll see where these plans differ is primarily in the deductible and out-of-pocket maximum amounts, which you'll see in the first and second rows on the grid, as well as in the PCP and specialist office visit copayments. PPO Plan 4 has a $30-40 copayment, PPO Plan 5 has a $40-50 copayment, and PPO Plan 6 has a 45-55 split. All 3 plans offer emergency coverage in and out of network at $100 copayment, and the urgent care benefit matches that of the specialist office visit copayment. On the following slide, you'll see an overview of the PPO high deductible health plans that we offer through the Alliance. Again, these 2 plans are very similar in that both have an in-network coinsurance amount of 0% after deductible and an out-of-network coinsurance amount of 50% after the deductible. You'll see here emergency, urgent care, and ambulance services are also covered with a 0% coinsurance after deductible, both in and out of network. On both plans, you'll notice near the top that for the in-network benefit, the deductible and out-of-pocket maximum amounts match. Out-of-network, there is a difference. All of the plans that we've discussed today are fully PPACA compliant, and all of them do come with the 4-tier prescription benefit. On the screen, you'll see several resources where you can go to both the New Mexico Health Insurance Alliance.com website or our lovelesshealthplan.com/brokers/New Mexico Health Insurance Alliance, or NMHIA. And at both locations, you can view all of the plan designs that we've discussed today. You can also access rates, brokers, and there is a customer service line here for the New Mexico Health Insurance Alliance, which you can contact, as Mike mentioned earlier. At this point, I'll go ahead and turn it back over to Mike, and he can give you an update on the exchanges.
Okay, thanks, Heather. Maybe some of you know, and I've tried to tell you in brief terms because there hasn't been a lot of information out on the exchange, but right about the end of September, the Alliance was contacted as the state was making an application, a grant application to the federal government to establish an exchange. And we were very fortunate in that the Alliance was named as the organizational entity in the application to house the exchange. Well, that was great news at that point in time. The better news came at the end of November, where the award of the grant came. The federal government announced that $34.3 million was going to be set aside to establish an exchange. So this money was going to be used to establish the governance structure, to hire staff, and to fund contractors and consultants so that we could get an exchange up and running. It was also to do research and prepare a plan to prevent fraud, waste, and abuse. We're charged with putting together a multiple-year operations plan, and we're also charged with determining an appropriate funding mechanism so the exchange is self-sustaining by 2015. All of these grants that are out there now do fund the exchange for the first year of operations in 2014, but the states have to provide a self-sustaining plan of operations beyond 2015 and forward. Now, there's a lot of activity going on. There's a lot of activity today going on at the state. As you may or may not know, maybe you saw the article that came out about Centennial Care. Medicaid is going through modernization, and there's a lot of information still floating around about it, but basically it's supposed to be a little bit more streamlined and hopefully a lot more technology advanced. When you think about our Medicaid department, unfortunately we were in probably the bottom 5 amongst all the states in our capacity to process the Medicaid participants' applications, which was really troublesome. But about maybe 6 months to 8 months ago, the state was awarded money to do the Medicaid modernization. So they're in that process. They've been working on it for about 6 or 7 months, and that's really great. That's one of the things that puts New Mexico slightly ahead of all the other states, because they're working on all of the eligibility requirements of an exchange. There's going to be a lot of interaction with the federal government, because if you can imagine, everything now seems to be on a COBRA event basis. Everything happens that way. Well, that's still going to happen into the future, but there's going to be more income event changes that are going to occur that are going to make people either eligible or ineligible for a particular coverage. As people either gain jobs or lose jobs, get married, get divorced, all those things will have an income aspect to them. And depending on the net effect to that final disposition, they may or may not qualify for Medicaid or the exchange. There will be this movement between the two, and it's something that we have to be very careful about. But needless to say, there's an RFP out. There's vendors participating in this very large information technology RFP with the state. And this is supposed to be, will be the core system of the state. When you look at it from an exchange standpoint, we will have a front-facing website, much like the Alliance, and there'll be a web gate. So as people come and they make application to the exchange, they will identify themselves through common identifiers. That hasn't been defined yet as what they are. But once they're identified, they will go through the web gate. I say they will go in Medicaid world. They will determine whether they're eligible for Medicaid and other food stamp programs and other help and assistance programs that are available in Medicaid. If they are, they'll stay there and be enrolled in those programs. If they're not, then they come back through the web gate and they work in the world of the exchange website and in the commercial world to gain coverages. So it's a pretty exciting time that that's all going on. Probably some of the challenges that we have is just timing. You all know 2014 sounds like a long time away, but it's getting closer every single day. The ISD2R is the Medicaid modernization. This is just the system replacement, actually. The modernization is the Centennial Care. But the system modernization started back in the third quarter of 2011, and it's moving toward its completion in 2013, so it's ready for 2014. Well, alongside of it, or almost running parallel but behind it, is the development of the exchange. And right now we're about 5 to 6 months behind getting started on that implementation. So that's a real challenge, but we will pick up those pieces. We are working to get arrangements with the Health Services Department, have them assign us as a subcontractor to them so that we can get the monies that are coming through the federal government to use to establish the exchange. All that's in process. Nothing's said and done, and everything is subject to the governor signing an executive order that would actually give us the authority to do all these things. So we wait on those things. Bottom line to that story is we anxiously wait. We anxiously anticipate getting started. So need you to know that. Once we have this exchange envisioned, we have these core functions that we're going to do, and this is going to sound a lot like the Alliance, but this is why the Alliance was chosen to do these things. We will be responsible for a new enrollment and screening of eligibility, and we're going to do that in consultation with the state and the federal government, because we're going to need to know income levels of people, and that means we're going to tap into those different resources so we can determine that income level. The next part of the exchange is really a new way to look at the insurance companies that are going to be part of the exchange. They will need to be qualified health plans. In order for them to be qualified health plans, they will make certification to the Department of Insurance to become qualified. Now, all of those specifics that will make them qualified are not fleshed out, but it will be things like they have an adequate network, there are not enough providers available in certain areas, and they have certain essential health benefits as part of their plans. You know, there's a lot of things that are not yet defined by the federal government, but the plan certification will go through the DOI, as will the rate. So now the rate, you know, last year they passed rate review at the DOI, and there's a new structure there where they have a more prescribed method, a more prescriptive method of how they look at rates. and now they're going to make those findings available to the public, and the public can essentially participate in hearings and say their voice as to whether they agree, disagree, or otherwise about those rates that are coming through. Unfortunately, this is going to add to some of the timing that the DOI has in providing its rates and getting them all settled so that we can put them into operations, but that's going to happen. The next important piece that's going to happen from the exchange standpoint is quality. There will be quality metrics, again, that will be sort of the threshold that all these qualified carriers need to come in and reporting of quality so that the end user will see that they're in a quality organization, a quality hospital with a quality physician. Is that in place now? No, not really. There is some public reporting, but not a lot, and that's being worked upon. The next is the shop and employer relations. This is just getting this word out to everyone. The exchange is coming. So I think you'll see it. Not sure what the moniker or the logo will be yet, but if you see NMHIX, which I think will be the term, you'll know to pay attention to it because we're going to try to get the word out on all of that. And as you can imagine, we're going to have eligibility for the employer, eligibility for the employees, but now we're going to have an appeals basis too, because there's going to be thresholds that the employees, they can only maximize, they can only pay 9.5% of their income toward a plan for their contribution. If they're beyond that, then they're going to start to come toward the exchange as an alternative. So it's going to be different there, and we expect that there'll be, employers who want to opt out of this and pay some penalties. Now, it's interesting on that part because in New Mexico, this isn't going to affect a lot of businesses because we're a small business state. And for everybody up to 50 employees, all these penalty rules don't apply. It's only 50 or larger that these people will be penalized. And so it's a different group. So I don't expect that to have much problem there. The other thing that's happened is that we think there'll be an emphasis on defined contributions, put forth defined contributions for employers to try to give them some stability in their rates as they move forward, with employees paying some differences. Now, that remains to be seen, but that's a vision ahead. There's all this issue of financial management that's going to come about where we have to do the exchange funding, pulling in from all these sources, pulling in from the feds, because for people who have on the federal poverty scale, if they're between 133% and 400% of the federal poverty limit, they're going to be eligible for a premium subsidy. So that's going to come into play, and the federal government and the exchange will be coordinating all this activity. And if you can only imagine changes that occur, people who drop off, changes in enrollment, it's going to get a little bit dicey, if you will, to keep that under control. The last couple of pieces that are on the exchange is the front-facing piece, the call center, the website, the outreach, and the marketing. And I think you'll be hearing more about that in the future. The last piece is just to do the billing and the collection for everything that's happening. So it's a big challenge, and we're excited, and we'll look for support from you and from all of the carriers to help us with this endeavor.
Great, thank you, Mike. I just want to add one final note and let you know that over the next several months, you will see that Lovelace will begin adding the New Mexico Health Insurance Alliance rate onto the quote grids for max-rated groups. So that is an exciting change that's coming your way as well.
We are very excited about that change.
Okay, great. And at this time, we'd like to invite anyone to pose questions to Mike or Heather.
Hey, Mike.
Yes.
There's a lot of talk by Mitt Romney saying that if he gets elected, that he will repeal the whole health care reform. Will that affect the exchange?
That's a great question. There's probably a couple of pieces to it. The first piece comes up at the end of this month. The Supreme Court on the 26th, 27th, and 28th is hearing the issues of healthcare reform for the mandate and whether all of it holds together or not. That'll be one of the first hurdles. I can't tell you what's going to happen there. I don't know what the outcome is going to be, but there's sort of thought out there that most of the things that have started, the fact that we have expansion to age 26, no rescissions, no limits, no lifetime limits, that all of that will continue going into the future. And the stuff that affected Medicare Part D too, for covering 50% of Medicare's members' costs for the donut hole, most of that is thought that that won't be taken back. That's certainly a challenge that the Supreme Court is ahead of us, and then the elections that follow that. I don't know how this all goes, but I do know that the state at least is planning it such that we want to stand up an exchange that works for New Mexico, and that regardless of what happens to the politics of the situation, we're still going to try to make an exchange that's meaningful so that small business can still have access through an exchange. And at least, you know, the thing I hear from the governor's office is that they want it to be business friendly. They haven't put a lot of hooks into that one way or the other, but to have a business friendly exchange is certainly something that is being supported by the governor. So all those things are ahead of us. Can't answer it directly, but I hope that helps.
Thank you.
Sure.
Any other questions? Okay, well that concludes today's webinar. Our next webinar, just to let you know, is entitled Compliance and the Appointment of Personal Representative Form. That's going to be on March 22nd from 10 to 11 a.m. If you would like to see a listing of our future broker webinars or listen to recordings of our previous webinars, you can find them on our Lovelace Health Plan website under the Broker tab. Thank you again, everyone, for joining us, and have a great day.